Hey everyone, Dr. Pimple Popper here, but you can call me Dr. Lee. Today we're diving deep into something super important, emergency contraception. You know, those just-in-case moments. Accidents happen, we've all been there. Whether it's a broken condom or you just plain forgot your birth control, it's crucial to know your options. And trust me, there are more choices than you might think. In this video, we'll break down everything you need to know about emergency contraceptives. We'll talk Plan B, Ella, even the copper IUD, we're covering it all. So stick around, hit that subscribe button, and let's get informed. Hi everyone, I'm Sejal, and I'm so excited to be here with you all today. With over 13 years of experience in pharmacy and a master's in regulatory affairs, I'm passionate about helping women understand their bodies and make informed decisions about their health. And today, we're tackling a topic that's often surrounded by confusion and, honestly, a bit of taboo: emergency contraception. But trust me, it's nothing to be ashamed of. Whether you're sexually active or not, understanding your options when it comes to preventing pregnancy is empowering. We're going to break down the different methods, how they work, and which one might be the best fit for you. So grab your notepad and pen, get comfy, and let's dive right in. Okay, first things first, let's define emergency contraception. What exactly are we talking about here? In the simplest terms, emergency contraception is a safe and effective way to prevent pregnancy after unprotected sex. Now, I want to be super clear about something. Emergency contraception is not the same thing as the abortion pill. It does not terminate an existing pregnancy. Instead, it works primarily by delaying ovulation. That's the release of an egg from the ovary. Think of it like this: if sperm is hanging out, waiting for an egg that hasn't been released yet, well, no fertilization, no pregnancy. Pretty clever, right? We'll be diving deeper into three main types of emergency contraception: the Plan B pill, you've probably heard of this one, the Ella pill, and even the copper IUD, which can also act as emergency contraception. So many options. Let's start with the MVP of emergency contraception, Plan B, also known as the morning after pill. It's the one you hear about most often, and for good reason. Plan B is widely available and doesn't require a prescription. So, what's the magic ingredient? Plan B contains a hormone called levonorgestrel, which works by delaying ovulation. Remember, no egg, no pregnancy. Now, how effective is it? When taken correctly, Plan B is about 75 to 89% effective at preventing pregnancy. But here's the catch: it works best within 72 hours or 3 days of unprotected sex. So the sooner you take it, the better. The great thing about Plan B is that you can usually find it over the counter at most pharmacies. No awkward conversations or doctor's appointments needed. It's like having a safety net right there in your medicine cabinet. Chapter 4, Ella, the long-lasting emergency contraceptive. Next up, we have Ella, another emergency contraceptive pill, but this one is a bit different from Plan B. It contains a different active ingredient called ulipristal acetate, which also works by delaying ovulation. But here's where Ella shines. It's effective for up to 5 days after unprotected sex. That's almost twice as long as Plan B. And when it comes to effectiveness, studies have shown that Ella is around 85% effective in preventing pregnancy. That's a pretty good track record, if you ask me. However, there is one key difference you need to know about. Unlike Plan B, Ella does require a prescription in the United States. So if you think Ella might be the right option for you, it's best to talk to your doctor or healthcare provider to get a prescription beforehand, just in case. Chapter 5, Copper IUD, the most effective emergency contraception. Now let's talk about the copper IUD or Paragard. Yes, you heard that right, an IUD can be used as emergency contraception. In fact, it's the most effective method available. The copper IUD is a small T-shaped device that's inserted into the uterus by a healthcare provider. It works by releasing copper, which creates a hostile environment for sperm, essentially blocking them from reaching and fertilizing an egg. And here's the amazing part. The copper IUD is over 99% effective at preventing pregnancy when inserted within 5 days of unprotected sex. Talk about peace of mind. But wait, there's more. The copper IUD doesn't just work as emergency contraception. It also provides long-lasting reversible birth control for up to 10 years. So you're not only covered in the moment, but you're also set for the long term. Chapter 6. Which emergency contraceptive is right for you? I know it can feel overwhelming trying to figure out which emergency contraceptive is the best fit for you. So, let's break it down. If you need a quick and easy option that's available without a prescription, Plan B is a great choice. It's readily accessible and works best when taken as soon as possible after unprotected sex. If you're looking for a more effective pill option, especially if it's been more than 3 days since unprotected sex, Ella might be a better fit. Just remember, you'll need a prescription for this one. And if you want the absolute best protection and are open to long-term birth control, the copper IUD is the gold standard. It's the most effective method available, and it keeps working for years to come. Ultimately, the best option for you depends on your individual circumstances and preferences. Don't hesitate to talk to your doctor or pharmacist. They're there to help you navigate these choices and find the one that's right for you. Chapter 7. Emergency Contraception Myths Busted. Let's address some common questions and myths surrounding emergency contraception. First and foremost, I want to reiterate, emergency contraception is not the same thing as the abortion pill. It will not harm an existing pregnancy. Another common question is whether you can use Plan B multiple times. The answer is yes. It is safe to use more than once. However, it's important to remember that Plan B is not intended to be used as regular birth control. And finally, there's been some talk about weight and Plan B's effectiveness. Studies have shown that Plan B's effectiveness may be reduced for women over 165 pounds. If this applies to you, Ella or the copper IUD might be more reliable options. Remember, knowledge is power. The more you know about emergency contraception, the better equipped you'll be to make informed decisions about your reproductive health. Chapter 8. Let's chat. Ask me anything about emergency contraception. That's it for today's deep dive into emergency contraception. I hope you found this information helpful and empowering. Remember, you are in control of your body and your reproductive health. If you have any questions, burning or otherwise, please don't hesitate to leave them in the comments below. I love hearing from you all, and I'm always happy to help in any way I can. And if you found this video helpful, please give it a big thumbs up and share it with your friends. Let's break the stigma surrounding emergency contraception and make sure everyone has access to accurate information. Outrow, stay informed, stay empowered. Well, there you have it, Emergency Contraception 101. It's like popping a zit. Sometimes you gotta do what you gotta do. And just like with those pesky pimples, the more you know, the better equipped you are to handle the situation. Remember, accidents happen, and there's absolutely no shame in prioritizing your reproductive health. Whether it's Plan B, Ella, or the copper IUD, you have options. So stay informed, stay empowered, and I'll see you in the next video. Bye, everyone.